Good morning, everyone. Happy Wednesday. My name is Alex Carrillo. I am the founder and CEO of Alcar Health. We are an advisory firm that specializes in supporting FQHCs through our network of vetted partners. We've been in the community for quite some time. We specialize in FQHCs. And the reason we put on these webinars is to bring to the community a little bit more of some of the partners that are doing work in the community that are supporting FQHCs, and especially for those that bring true value to the FQs because they know how to work with that population. So with that being said, today we have the founder and CEO of DirectDerm, Dr. David Wong. Before I let him do an introduction, I do want to let everyone know if you have any questions, feel free to drop the questions in the chat. We want to answer those questions as we go. You don't have to wait till the end. So happy to answer those questions. Thanks again for joining us. And with that being said, I'll open it up. Dr. Wong, tell us a little bit about yourself, who you are, how you got started, and then we can go into, we'll do a poll, and then we'll go into the presentation, Dr. Wong. So the floor is yours.
Thanks, Alex. Thanks for having me here. Thanks, everyone, for joining today. I'm David Wong. I'm a board-certified dermatologist. I'm also an associate clinical professor at Stanford in the Department of Dermatology and still teach there. Had founded DirectDerm really to address the needs for medical dermatology access in our community. And as you probably know, and many of you experience challenges to get into medical dermatology care. So happy to speak to you a little bit about how we've been working with FQHCs in the community for over a decade now to help fill dermatology care needs.
Thank you. We're going to take a quick poll just to get an understanding of the folks in the room. The first question, you just pick an answer. It's real simple. Is what is the average time for your patients to see a dermatologist once you refer them out, right? So is it usually taking 1 to 2 weeks for them to see a dermatologist? Is it taking 2 to 4 weeks, 4 to 8 weeks, or 8 weeks plus? So if you could do us a favor, pick one of those answers that will give us an understanding of just kind of the landscape of who's in the room.
Looking at 2 to 4 weeks is...
Okay. So that's kind of the average. All right. Let's go to the second question. So second question is, do you have a dermatology practice in-house or do you refer it out? Options are we have 100% in-house, you refer out, or you have both. You do some in-house, then some of it you refer out. We know in FQHCs, all three options are possible. So just trying to understand what some of those may be for the folks on the call.
Looks like most are referring out.
Refer out. Okay, awesome. We'll jump into Dr. Wong's presentation. Along the way, I may ask some questions. And a reminder, if you have any questions, please go ahead and drop them in the chat. We want to answer them as we go. And I will turn it over to Dr. Wong to share a little bit more about DirectDerm and the work that they're doing with.
Thanks, Alex. And thanks, everyone, for joining. Again, my name is David Wong. I'm a board-certified dermatologist, clinical associate professor in the Department of Dermatology at Stanford, and founded DirectDerm as a service because we saw a lot of the challenges our communities face for getting access to medical dermatology care for patients in the community. This was an article that came out in the New York Times that didn't put the dermatology specialty in a very good light, because they reported how it was easy for patients to get a same-day appointment if they were coming in for Botox or some cosmetic treatment. But if they had a changing mole or some concerning medical problem, they had to wait weeks, months to get in for an appointment. And this is unfortunately a problem that's pretty widespread. The challenge and long wait times to get into a dermatologist. Some of it does have to do with many dermatologist practices spending a fair amount of their time on aesthetic cosmetic services, not just medical services, but also the amount of dermatologists we have and that we have serving our communities, the geographic disparity on where dermatologists are available in practice, and the insurance that most dermatologists take. And probably many know that most dermatologists don't take certain insurances, particularly Medicaid or Medi-Cal, which makes it a challenge for populations, especially those from FQHCs, to get access to medical dermatology care. So DirectDerm was really founded to really bridge that gap and, serve all patients regardless of what insurance they have and provide that access in a timely fashion 2 board certified dermatologists for high quality care for all of our community. We do what's called hybrid dermatology care, where we have integrated virtual care with in-person care to really increase the efficiency and access to patients in the community to care. With this, we're able to provide care for whether it's an acute problem, chronic condition, or things that just need to be triaged appropriately for in-person appointment, like identifying a potential skin cancer like melanoma that needs an urgent biopsy. And so we've been providing this care, again, like I said, for over a decade to FQHCs and our communities to provide timely access to a dermatologist in less than 48 hours with board-certified dermatologists. And we've been demonstrating that we're much more cost efficient in the way we are able to deliver care to our community. So what is exactly hybrid dermatology care? It's really leveraging virtual care and really integrating it with traditional in-person care. Because dermatology is such a visual-based specialty, dermatologists can identify virtually skin conditions with accurate diagnoses and treatment recommendations for patients immediately, and allows us to connect patients immediately without delay to a dermatologist. Now, there's 2 different major ways that we deliver virtual care that you may be aware of. The 2 forms that have been described are what's called first store and forward or asynchronous care, where it's asynchronous, where with images and pictures taken of the skin problem can be sent over. And in our program, within 48 hours, we provide diagnosis and treatment recommendations from a board-certified dermatologist, as well as live interactive video care, where we schedule a live interactive video appointment virtually with the patient or with the provider and patient. And virtual care can really, we've shown, be very beneficial for, number one, for that initial appointment to help immediately see the patient, provide care immediately with immediate access, and then triage those patients that actually need urgent in-person visits instead of those patients waiting weeks to get in. For example, something we're concerned about, for example, aggressive skin cancer like melanoma. We also use it for follow-up care, to improve continuity of care as, geographic challenges to for transportation to get into the office regularly. We use virtual care regularly for checkups and ensuring that patients are compliant with their medications and that their disease is under very good control. So again, store and forward dermatology care where images can be taken, like for example, this healthcare worker that's assisting in taking a picture of this person's rash on their face, can take those pictures, send that securely over DirectDerm's HIPAA compliant platform, which is no cost to FQHCs or anyone who uses it, sends that over along with medical history. And again, one of our board certified dermatologists will provide a full report with diagnosis, treatment recommendations, and send over prescriptions as needed or give guidance to the referring provider on what prescriptions are needed, and then triage those patients in person for those subset of patients that need, for example, a procedure or need something to be seen in person. We also provide live interactive care through a live interactive video that can be scheduled with one of our dermatologists or other providers, where we can have a direct visit over a video with the patient or with the patient and the provider. It's great for certain, instances such as, for example, we get a lot of patients that have severe nodulocystic acne, for example, that need potential consideration for treatment with Accutane. So we can counsel those patients and do that through virtual care without delay and get them appropriate on those medications as needed. And of course, we have in-person care. We have 6 clinic locations in Northern and Central California and continue to expand those locations so that we can triage those patients for in-person visits, procedures as needed. Even in areas where we don't currently have a clinic, we work with local dermatology clinics that accept all insurances, so we can help triage those visits. So those clinics that classically it's very difficult to get into, we work with them because we triage and identify, for example, those melanomas or something more urgent, a more urgent rash, and can get them in more quickly based on the patient needs. We have a great team of dermatologists, all board certified by the American Board of Dermatology, trained at top U.S. institutions, including Stanford, UCSF, and others across the country. The great thing is it connects you not only to in the community. It's great with a community dermatologist, but on our panel, we have not only dermatologists board certified in general dermatology, but also board certified in pediatric dermatology, dermatopathology, surgical dermatology. Many of our dermatologists also specialize in certain aspects of dermatology like skin cancer, bullous disorders, blistering disorders, psoriasis, and are world experts in that. So it really allows our service to connect patients also to dermatologists with specialized expertise that otherwise the patient would have to get into an academic center to get those types of assessments and care. We see everything from anything on the skin, hair and nail, anything you would refer to a dermatologist, whether they have an unidentified diagnosis, unclear, or they have a known diagnosis like psoriasis, but need proper care from a dermatologist and proper management. We manage, of course, like mentioned, acute conditions as well as chronic conditions and all ages from newborn to elderly. Again, we have pediatric dermatologists, so even rarer things in children, we see that. We have experts on our panel that see these patients all the time. We're also contracted across the board with national and regional health plans, from commercial plans, from the Blues to United, to Cigna and so forth, but also see, of course, Medicare Advantage plans, and especially, for the population we're talking about, we see Medicaid, Medi-Cal, and most of the managed Medi-Cal plans, and IPA. So our mission has always been to serve all and make our service available. So nice thing working with us. We are contracted with most plans, regardless of insurance line. So I'll go through two patient examples just to illustrate the power of having a hybrid dermatology service available to your FQHC. This was a 7-year-old girl with this pigmented lesion on her scalp. It was a 5-month wait in their community for seeing a dermatologist. Sent this picture over along with medical history. Our dermatologist saw the patient in a day, and the dermatologist was concerned that needed a biopsy. So got the patient scheduled for a priority appointment for a biopsy. And it did turn out to be a melanoma in situ. And so for those non-clinical in the audience, melanoma is a type of skin cancer that can be aggressive. In situ is the stage where it's just on the top layer of the skin and hasn't invaded. So that's the stage you want to detect it at this early stage, because once it starts to invade, it has the potential to metastasize and have very poor outcomes for patients. But in this case, being identified very early, identified at its earliest stage, able to get this young patient over for surgical excision in a week, and the patient did very well. And this is just a chart that shows you the detection stage of melanoma. You detect it early at the in situ stage before it's invaded. The 5-year survival is 100% with modest cost to treat the melanoma. But as the melanoma progresses, you can see 5-year survival plummets and the cost of care rises exponentially. So again, just one of the conditions that we see in dermatology where early detection is critical for optimizing. The second case I'll show you, this is a 56-year-old man who had this rash throughout his whole body, just a close-up of his foot. Was being treated in the primary care as a fungal infection, which is a reasonable thought on the differential diagnosis, but was not responding. Again, 5-month wait to get into a community dermatologist for this clinic. Sent over to us. Our dermatologist got back to the clinic that were concerned that this is actually a drug reaction based on the medication list the patient had, and advised them to switch that medication and treat with some topical medicines to calm down the inflammation. And you can see after drug discontinuation, after the rash had mostly resolved with just some post-inflammatory pigmentation change that will fade with time as well. So again, it's early detection and it's accurate diagnosis, connecting patients with dermatologists when they need care to improve patient outcomes. So in some, direct derm has been supporting FQHCs and clinics in our community, RHCs, for over a decade, really for the mission to, again, improve access to care when patients need it. Early detection, which is critical in many cases for many of these patients, and intervention with proper treatment plans, efficient and effective triage where we can identify patients that need to be seen quicker and can get them in appropriately into one of our clinics or another partner clinic in the area when needed, improving continuity of care so we really are able to connect and keep connected with our patients with the different modalities, both in-person and telemedicine, video, and store and forward, to continue that critical continuity of care for our patients. And also all of this, the efficiency we've shown to reduce the cost of care. So stop there. And again, thank you all for your attention and the opportunity, and welcome any questions.
So working with FQHCs, you did mention you are contracted with most Medicaid and Medi-Cal plans. We work very closely with you, and we understand that I think in northern, central, and northern California, you cover, if not all, most plans. My understanding is you are expanding into Southern California in the near future, right? So if someone on the call is from Southern California, that is coming. If there's interest, let us know. But as far as Medi-Cal plans, my understanding is you guys take most, if not all of them, in the central and northern part of California, correct?
That's correct. That's right. Even some in Southern California, and we're expanding that as we speak. So yes.
Now I've experienced DirectDerm personally. I live in Las Vegas, and I remember being diagnosed. I had a rash around my eye, and they would tell me, "Oh, go to the dermatologist," and it would take, I don't know, 2 months before I could get in. By the time I was in, it was gone, and they said, "Well, come back when you have it again," right? Luckily, you were able to help me, and it got taken care of, right? Send you the pictures. You were able to prescribe a medication, picked it up the next day. So I know the importance of being able to do that, right? I think in your experience, how many of the cases are solved through e-consult versus having to be seen in person, right? Mine was pretty simple, I think. But in your experience of all the patients that you guys service, what percentage can you do telehealth versus, hey, we have to see this patient in person?
Great question. So yeah, typically on average on a typical population of various conditions, over 80% of the patients we see don't actually have to come in to see an in-person dermatologist. Of course, if they want to, they're always welcome to do so. But yeah, the majority are can be managed virtually, just like in your case where we send an appropriate prescription and can follow you virtually to ensure that treatment is effective. And just so everyone knows, again, all of our dermatologists that see your patients are licensed to practice in California. We're able to provide care to Alex because we also have licensed dermatologists in Nevada. But yeah, all the dermatologists are local here, serve obviously for everyone here on the call, California.
And thank you, Dr. Wong. You mentioned something about, obviously you have 6 locations in the northern part of California. I know there's plans to expand that. And if someone's interested, we're happy to send you a list of where those locations are. And I think what makes you guys unique is the fact that your team really understands FQHCs, and you've been doing that for many years, right? What's different? And I know the answer to this, but I think the audience should know what's different when someone works with DirectDerm from an FQHC perspective and they're referring patients. What does your team do that's different than just sending them to any other dermatologist?
Yeah, many things. I mean, number one, that is our mission, and everyone from the dermatologists to all of our staff are focused on really providing care to all individuals, especially patients that classically have not been. We, as mentioned, insurance coverage, we work with and contract with Medi-Cal plans, managed Medi-Cal plans, work with these populations, so very comfortable. So we see these patients every day. It's actually the majority of the patients we see, vast majority. So we understand the population. From language support, our staff, a lot of obviously Spanish-speaking patients, our staff support, and most of our staff are actually bilingual. So we support that. We support other languages. If we don't have in-house, we have other services there. We understand the different types of conditions that appear in these different populations. There are some variations on prevalence of different types of conditions. So we're experts really on managing all the conditions we see in these populations throughout California here. We work closely with FQHCs where we do, detailed reporting, which we can give back, really communicate and provide reports on, referrals, time to see patients, reports on who we're able to see, so we closely work with them. We work closely also because we work with Medi-Cal plans. If needed, we work with assisting with prior authorizations to see a specialist so we can assist your teams and take a lot of that work off of your teams to get authorizations from the appropriate Medi-Cal plans. And we have contact support teams that work closely with you. So we'll assign a dedicated provider support representative that supports your team that you can contact at any time that can help support and answer any questions, assist with anything urgent that's needed. So I think, we've been working again with FQHCs for over a decade, and I think they find that, our sort of dedication towards this population and supporting these clinics is customized to them. That really helps to facilitate, the care that they're getting for their community.
Yeah. And I can definitely vouch for that. Do you accept private pay?
We do. Yes.
Okay.
So we take private insurance, we take commercial insurance, we take self-pay. We have more affordable rates for self-pay for patients as well that don't have insurance or have some insurance that we just don't happen to be contracted with, although we're pretty widely contracted. So yes.
Awesome. Going back to the FQHC side and how you guys work with them, I think one of the things that every FQHC, every provider experiences is the black hole, right? You send out the referral and you don't know what happens to the patient, right? The specialist is not reporting back. And I think what you guys have done that it's really awesome is you're reporting back consistently to the FQHC. Hey, here's all the referrals you sent me. Here's how many people we've seen. Here's how many people decline care. Here's how many people we haven't been able to get a hold of. And I've seen those reports, and I think that has been very beneficial to a lot of the partners that you're working with. So I think that's a huge benefit because now, from the FQHC perspective, you understand where your patient's care is, right? Have they been seen or not? We have another question that says the picture the patients provide, are those submitted through a portal? We have had patients say they have to go into stores to get the pictures completed.
I'm sorry, I missed that.
So I think there's two parts, right? One of the questions is the pictures that patients provide, are those submitted through a portal?
Mm-hmm. Okay.
That's one question. And then the follow-up is we have had patients say they have to go into stores to get the pictures completed.
So the question is really about how does the store and forward telemedicine work and how does that? So there's two different ways. First of all, we offer store and forward telemedicine to patients directly. So you can place a referral and we can assist patients to submit those photos and medical information to us. And then we send a report back to the referring physician to keep you in the loop. Also, there's also e-consults through where we can set up your providers to send on behalf of the patient and communicate as a provider to provider store and forward telemedicine consultation. So both are available and it's all through a HIPAA compliant platform. And again, there's no cost to the partnering clinic or the patient there. Now, as far as how the patient can take those photos, so they can do that from their home. Most patients do that. We assist them. If it's an area of the body they can't reach, usually we assist them and guide them to have a family member do that. And they can do that from, a phone, a tablet, anything internet connected, they can take those photos. For those patients that do need assistance, where your clinic's isn't able to do it or we want to assist them, they can come into one of our clinics locally. Sometimes also our partner FQHCs, they can come in and have those pictures taken for them. I think that was what was mention that question. So that is more of a option for patients who are unable to do it on their own with family assistance from home or from the referring physician's office. But that's something we offer to bridge again that access gap. We find in these communities it's a small percentage of patients that can't get it through other ways, but we offer that just because we don't want to leave any patients without a resource to be able to get connected with our dermatologist.
Thank you, Dr. Wong. I have one last question here, and I'll see if the group has any other questions. So we talked about the reporting. We talked about how you guys work with FQs, the type of insurance. I know I've been asked this question by other FQHCs is, well, you guys, DirectDerm does all this reporting, all this communication with us. What's the cost, right? What are you going to invoice us for all this additional work that DirectDerm is doing? So what's the answer to that question?
Yeah, there is no cost. So as far as certainly no cost that we are charging to the FQHCs at all. Again, because we've been able to get contracted with Medi-Cal plans and other insurances widespread. We just bill the insurance for the care that we provide, and the support and the platform and all this is just part of our mission to provide access to care there. And we don't charge the patient. We don't charge the FQHC partners for any of that aspect. The only thing we're charging is billing insurance as normal. So obviously with Medi-Cal, there's no cost to the patient either. With commercial insurance, there may be copays and deductibles, which is the same, similar, just depending on their plan there. But yes, no cost, which is important, obviously, again, providing access and without these barriers.
Yep. Perfect.
Yeah. So, that's a key to the partnership, of course, is, again, we have a dedicated team on our end that will work closely with the FQHC's team, again, provider service team, with certainly one point to be their main point of contact that's always there to support them. On the FQHC side, it really is, kind of flexible how they want to set that up, but usually there is a manager that interfaces with our provider service representative. Often is someone who heads the referral team, for example, the referral management in that FQHC. Sometimes it's one of the other managers, but we're happy to work with the team. We can, really with referrals, it's very straightforward. Again, referrals, it's just like you refer out to, so no change in referral, you just refer to us and we'll assist the patients either, through telemedicine or whether it's Store and Forward, live interactive, or schedule into our clinic. We'll take on that appropriately. If it is something where you want to set up, again, this e-consult where you can do the provider to provider consults, we provide that training, again, without costs. Our provider representative will train the relevant team people on your staff. We can also do a presentation to your provider team so they're aware of, obviously, of our service and build those relations, but we'll set all that up through our provider representative team, again, without cost. No, please reach out. Like Alex said, I'm happy to support. If you just have questions, if we can be of help, that's what we just want to make sure and get the word out to more of the communities, because our mission, again, is to fill these access gaps so where we can find it. And just also want to emphasize also, it's this hybrid dermatology care really makes it flexible. So it's also, I should emphasize, it's, some patients come into our clinics first, sometimes, patients who are appropriate. There are some patients, one question that often comes up is everybody appropriate for telemedicine triage, and not everybody. So if it's a full body skin check, we schedule them directly into our clinic, or into another. So it just depends on what it is, and we do what's right for your patients and to get them care as quick as possible. And we'll work closely with anybody who has the need. So thanks again for the opportunity today.
Awesome. Thank you, Dr. Wong. Thank you, everyone, for joining. Hope you have a great day. We will follow up with the recording if you want to share this with any of your colleagues or anyone that you think could benefit from this information. Again, if DirectDerm can be of service, feel free to reach out directly or through us. Happy to help you guys. Thank you, everyone. Have a great day. Thank you.